And that leads me to another very hot topic in biohacking, which I know you're very into, is red light in general, right? Red light LEDs,
Oh,
everything,
yeah,
red light for mitochondrial health.
absolutely.
When differentiate that kind of the laser light versus red light versus infrared light, what are you looking for as far as the light spectrum and technologies to regrow hair?
Well, the vast majority of research has been done in the visible red spectrum when it comes to hair regrowth. And the reason is because that wavelength spectra that we see is red light, usually somewhere between 630 and 670 nanometers. That's the color red that we see. That has the highest absorption at a cellular level. So researchers like Dr. Michael Hamblin, who is really the guru of photobiomodulation, and he really detailed out all the mechanisms of action in the recent years through being probably the most prolific researcher and publisher on photobiomodulation in the world. He's the one who kind of elucidated those pathways. And so what we know is that red light is then absorbed at the level of the mitochondria, and the mitochondria, which are the energy centers within the cells, basically get charged up and make energy, right? Kind of like a battery from this red light, the photons of light at that wavelength. And they're absorbed at the mitochondrial membrane, right at the cytochrome C oxidase, which is the electron transport chain. And you get this major output of ATP, which is the cellular fuel, if you will. And it's used for a lot of different things. And there's huge cascades that occur from, energy production to anti-inflammatory cascades. But really the main focus for hair regrowth has always been in that red light spectrum. Could these other spectra be helpful? Like, generating some heat at the level of the scalp may actually help us with the transmission of, let's say, pharmaceuticals or other topicals into the scalp. So there's some improvements when you heat up the scalp a little bit or the skin, you get better penetration. Some of the far infrared penetrates a little bit deeper. So if you're trying to treat the bone or even brain tissue and things like that, they use that in traumatic brain injury and stroke patients, things like that. But for superficial work at the scalp, today the go-to wavelengths are really visible red. So that's what's in the turbo laser cap. That's what we've used here in the practice in tens of thousands of patients. We use it for wound healing after hair transplant surgery. We use it before and after every biotherapy treatment, every PRP, every platelet-rich plasma, every PDO grow, every FUE hair transplant. We're using red light therapy. And even to the point where we're doing a photoactivation of our platelet mixtures before we do the injection of those platelets and monocytes into the scalp, because we know that there's some cellular activity that bumps up from that red light exposure.